Sanford here, co-founder and chief growth officer, and I want to just thank everybody for taking time out of your busy day to learn a little bit more about Healthiest You. If it's your first time attending our national webinar, thank you. We appreciate you attending, and of course, if you attend most of our monthly national webinars, thanks for coming back. Again, we appreciate you joining as well. So let's go ahead and get started. As you see here, our theme for this month's webinar, we're kind of playing off of the March Madness and the college basketball finals coming up here, and our rendition of attacking those common issues and resolving those issues for folks, healthcare issues, in a very simple, effective, efficient manner. And that's really what we're focused on here. Healthiest You is just in the process right now of evolving in a major way with some new technology we're rolling out, which I'm going to walk you through here, which is certainly industry-first technology. You've probably seen it out there in the media. We had a big announcement at the South by Southwest conference in Austin, Texas, a couple weeks ago at their MedTech conference there, which got a lot of buzz. We were featured on TheStreet.com, MedTech News, PBS airing this week, Yahoo News, and many other publications and media outlets, as this being just really a revolutionary technology that's bringing something that's really never happened in healthcare, which is simplicity and allowing a consumer to easily navigate the healthcare system, resolve their issues in the most time-efficient and cost-efficient manner, and which creates a great discussion point for you all on the phone here with your clients today on how to just have a different discussion with them and show them how Healthiest You can have a big impact on their cost, their benefit plan design, and productivity of their employees. So let's go ahead and get started. First, we'll kind of walk you through just the product overview, right? And then we'll demo some of our technology here. Our smartphone app is now live on the Droid platform. For those of you that have a phone working on the Droid software platform, you can download the Healthiest You app on the Google Play Store. You can simply search HY and you'll find it, or Healthiest You, all one word. If you do Healthiest space You, you'll get our previous app, which is just purely wellness focused, which will eventually be transitioned into our new app. So search HY or Healthiest You, one word, for those Droid users out there. Apple is still in the approval process. We're getting updates from them daily that it's in the review process, and we're hoping to have that live on Apple Store any moment, and we'll be sure to let everybody know about that. So very, very excited about the new release of our smartphone app. Now keep in mind, this is the first rendition of the app. Of course, the first time apps come out, there typically are some glitches here and there, so we're watching feedback closely. So far, everything's been great, but if you come across something that didn't quite move as smoothly as it should have, just let us know, and we'll take a look at that and provide updates frequently to continue to improve that app. So there's a lot of technology built in there to make this work, so it's really exciting. Now at Healthiest You, what we've built here is a platform for you to plug in all the pieces of healthcare. So I consider everyone on this line, the brokers, the consultants, the payers, you're kind of puzzle masters, right? You meet with your client, you find the best health insurance provider for them, the best type of coverage, maybe you put in some ancillary medical benefits, the dental, the vision, and so on, and you put all these pieces together and you create a very nice solution for them that's the best to fit their needs. Well, Healthiest You is the platform where all those puzzle pieces fit on, and you can wrap it up in a nice bow, and you can give that to the employees and say, download the Healthiest You app, excuse me. The first thing we put on there is, of course, telehealth, because that's the fastest growing sector in healthcare. It's kind of a no-brainer, right? You can call a doctor 24 hours a day in 48 states, and 94% of the time resolve your issue right over the phone for the most acute issues. So that's the first thing we put in there. Then you can plug in your major medical and all the other pieces, and they can access functionality with all the benefits here on the Healthiest You app, which we'll demo to you in just a moment. So we get put in the telehealth bucket with some of the other folks in that industry because we do redirect industry-leading claims, right? The highest amount of redirection and usage in telehealth in the industry. So we get compared to other telehealth providers, but we're much more than that. But let's look at the telehealth piece here just for a moment. We know that over 70% of the reasons you go see a physician, you can handle those right over the phone. So, of course, we're going to make that functionality easy on the web and on your smartphone app to get connected. You look at the top 9 reasons we visit the emergency room, almost identical to the top 9 issues that we're resolving 24 hours a day in 48 states on the Healthiest You Physician Network. Our physicians are all U.S.-based, board certified. They're trained to diagnose, treat, and prescribe over the telephone. We are the largest telehealth network in the country, over 2,300 physicians and growing. Service is available in 48 states. So today, Idaho and Arkansas are the only states we're not providing access to doctors to. So again, 70% of those needs you need to see a physician. Get on the phone, let's get connected, and we'll resolve it that way. So here's how it works on the telehealth consultation side. There's 3 ways to access: an 800 number, our web portal, so you can go online and log in and schedule an appointment with a doctor, or now on our smartphone app. The first thing we're going to do is make sure we have your medical history. So we're going to have you provide that information for the doctor to review. We route that call to the appropriate doctor that's available. The doctor reviews the patient history and then is connected to the member. If a prescription is required, we use eScript to send that prescription to the member's choice of pharmacy. We can send it to 76,000 plus pharmacies across the country. The doctor then updates your EMR with the consultation notes. Those notes are stored in your Healthiest You member portal online, or you can access it on your phone. So you can see call times, what the diagnosis was, and information around that particular consult. Survey results, off the chart positive, 97% customer satisfaction. 94% of our calls that come in are resolved with no further action needed. They've got a diagnosis, they got their questions answered, they're ready to move forward on with their day. 9 minutes is the average callback time from the doctor, so faster than you can put your shoes on and start driving to the doctor, assuming they could get you in right away. You're going to be on the phone, doing a consultation, resolving your issue. The average time spent with that doctor over the phone is about 13 minutes, so that's our average consult duration. We have a 95% client retention rate. So folks that bring on Healthiest You at that employer group level, that individual level, they keep it. They find value in that, and it really becomes the center of their health care needs. Typically, we have a $0 consultation fee. So we have a few different product offerings, but by far the highest demand, the one that everybody wants, is that 0 consultation fee. We're just going to do a PEPM monthly low fee. It's going to cover everybody in the family. They're going to have unlimited access to the doctor's full use of the app and engagement tools, everything we have built in there. Now, what we're passionate about here at Healthiest You is getting people to use our app, our service. We have a 42% utilization rate on our telehealth component, in an industry average of 2%. So we're a much different model. Are there other providers out there that are low cost, check the box, put it in there, hope nobody uses it? Yes, there are plenty of those providers that you can go to. But if you're looking for a provider that's going to become the front of the plan, really help redirect claims, increase productivity, reduce absenteeism, high utilization on the telehealth side, which drives down claims, Healthiest You is definitely the product for you. So the question is, how do you do it, right? How is your utilization over 20 times higher than your closest competitor? Well, we kind of put this in a slide to demonstrate that. So first off, our competitors, it's pretty simple. They'll give you a flyer and make sure that all the employees have that flyer that talks about their service, and they might send an email or two. Where we're much different. We have a third of our company is made up just of folks that all they do when you sell a group, they reach out to that group. They welcome them to Healthiest You. We send them a very nice admin kit with some Healthiest You swag in it, some coffee cups, some break room posters, the basic stuff. And then they put together a 365-day marketing plan. So the first thing we're going to do, of course, is open enrollment. We're going to tell them, hey, use Healthiest You first. If you can't resolve your issues, then use your health plan. That's more time-consuming, more costly. We're going to have an app drive, so we're going to get them to download the app. We're going to send out a very nice fulfillment kit. It looks like this. It's done by the same company that does the Amex Black Card. Very high quality, gives them an overview of the service, shows them how to download the app, gets them engaged. We're going to create a co-branded enrollment site. Now, these are for the bigger groups that want a website where they can drive the employees to learn about Healthiest You, and they can log into their Healthiest You member portal and get acquainted with that. So when they really need that care, they're all ready to go. Of course, monthly email communications, the basics, right? The tongue-in-cheek, fun little communications, share testimonials, keep Healthiest You on the top of their mind, and not let them forget about it. Our product mix is very unique. It's instead of just saying, hey, if you're sick, come to Healthiest You, it's sure, the doctors are waiting when you need them, but we have all kinds of other great components here of our product offering, which I'll get into in a moment, that will keep Healthiest You on the top of your mind and drive up utilization. Speaking of utilization, we have, of course, great utilization reporting and monitoring. So for those groups, small groups, we do annual utilization reports. The larger groups, we typically do quarterly. If you have a need for a utilization report, you got a meeting coming up, you can certainly call us and we'll get you one as needed, but typically quarterly and annually. Very nice reporting. We show you the average, or not the average, the top diagnoses within that company, when folks are calling in. So call times are important. That has an impact on ROI. Had a great testimonial come in a couple weeks ago that just shows how big of an impact this has on absenteeism. So this gentleman woke up at 6 a.m. with horrible allergies. Eyes were incredibly irritated, bad cough. He was just a mess. But he had a huge presentation coming up that day at 9:30 in the morning. So he's going, how the heck am I going to do this presentation with this big client when I'm feeling this way? He gets on the phone with Healthiest You right away. Gets connected with a doctor in less than 5 minutes. Gets his diagnosis. The doctor sends over his allergy medication. He had some eye drops and a Z-Pack, I believe, if I remember right. Jumps in the shower, gets ready, swings by the pharmacy, picks up his medication, gets his eye drops in, takes his Z-Pack. By 9:30, he's feeling a lot better and well enough to do that presentation. Now, prior to Healthiest You, what are his options? Right, he's going to try to call his doctor, which the chance of that doctor seeing him prior to that 9:30 meeting is probably impossible. Urgent care center, probably not even open yet. They might be open depending on where you're located. Waiting in line there. Long story short, that presentation gets bumped to another day, and that person's probably out of work and waiting to try to get care instead of really having that convenience of Healthiest You. So we're going to share the data back. We're going to ask the folks when they call in, what would you have done if you didn't have Healthiest You? Would you have gone to your primary care doctor, gone to the urgent care center? So we share that data back so we can package up a nice utilization and return on investment there. So what's it look like from a group level when you have this 40+% engagement, this great utilization? Well, naturally, you see a shift in claims. So this case study here was provided to us from a consultant that had one of our competitors' products for 2 years. They saw no change in the claims in that plan in the 2-year time, switched them to Healthiest You. First year, claims go down 39%, cost around claims goes down 37%, plus 2.2 fewer paid time off days per employee. If we reference the Aon study here on what it costs a company per day to have an employee gone, it's an average of $300. Just this component right here more than covers the cost of Healthiest You for the entire year. But this group, just claim redirection, was $30,387 claim redirection. And they spent, of course, over half of that on the Healthiest You for the entire year. So they got over 100% return on their investment. And, of course, they're loving Healthiest You and really shifting the delivery of care at that company. Here's another example. Let's go bigger, self-funded here. 5,000 employees in the group, 2,200 of them on the health plan. They're in their 3rd year with us, but first year they did 1,071 telehealth consultations. Now, this is pre-smartphone app coming out. Everything we're talking about right now, 42% utilization, these case studies are pre-smartphone apps. So you can imagine where utilization is going to go now with the app coming out, engagement, claim redirection, whatnot. So they 1,071 consultations. They were at 44% utilization their first year, reduced urgent care spend by 37% their first year with Healthiest You. This group has 40 HR directors in 70 different locations. We trained every HR director, got materials to every location. We keep the communication going to that group. They're having tremendous utilization. And the Humana rep about fell out of her chair when she came back and said, how'd you guys reduce your urgent care spend by 37%? Your costs have gone up every year. What's going on? And the consultant says, well, we got Healthiest You in there. So this stuff, it really does work. Self-funded groups, you can show that savings right away with the claim redirection. All right, now let's talk about our new technology here. Let's talk about the platform we've built to make it easy for you to navigate care and answer your basic questions. So the first thing you do when you download the app is you kind of set it up, right? So you want to personalize your family tree. You can upload your photos. We got the Griswold family here as an example. Next, you sync your health insurance plan. So if you have health insurance coverage, we have a drop-down box of about 146 different payers in here, which covers about 90% of the market out there. Find your healthcare provider, put in your member ID from your health insurance card that you typically keep in your purse or wallet, and you're synced. So what that's going to do is it's going to help you find providers. It's going to help you really just kind of see your deductible, where that stands, and I'll get into that in just a moment. One of the cool features we built in, one of my favorite features, is the geofencing reminders. So we geofence the costly care locations. So in this example here, it's an urgent care center. So this is commonly used in retail, this technology. Latitude and longitude, you mark the urgent care center. So with your app, when you walk in there, it beeps and reminds you, just like you got a text message, but it says a benefit reminder. Don't forget you've got Healthiest You, and you can connect now with a doctor. Avoid that costly visit and the time and the germ exposure there at that urgent care center. Click Connect now, and we dial you right into our CareLine representative team and get you connected with the doctor. So we want to remind you that you have Healthiest You. We all get busy. You might forget, right, or you're just not feeling well, and you just get up and naturally you run to an urgent care center. But we want to remind you at the time of need that you have Healthiest You. We do the same thing with pharmacies. So over 76,000 pharmacies we geofence. So you walk in there, we're going to remind you, hey, if you're in the pharmacy to pick up a 6-pack of beer, dismiss us. But if you're in the pharmacy here to pick up your medication, let's check the prices here real quick. Click Check the Prices, put in your medication there that you want to search, and we'll find the best prices for you. You can also search in-network providers. So this is outside of telehealth. So remember, you put in your group ID with your health plan. We're going to show you how to search providers right within the app based on your particular health insurance coverage. Now to jump back here on the prescription side, we're going to show you the best prices on medication. So when you put in your medication here and the dosage amount, we'll show you the top 3 locations where you can get that medication for cash price. So this is outside of your health plan, or maybe you're on a high deductible plan, which majority of folks are today. This can help you save a lot of money. It will beat your co-pays 7 out of 10 times. So what it does is instantly, just like Amazon.com, shops a bunch of locations, 10 different PBMs, all pharmacy locations, finds any specials that are being run, the best price for that medication. We get rave reviews on our prescription savings program. You can also do the same thing for procedure pricing. Just put in a procedure. It's going to show you the average cost in your area for that procedure. So if you have to have an MRI done, and you're on a high deductible plan, and you're like, oh my gosh, how much is this going to cost me? It's going to find that best price right there for you. So you know how much you're going to get hit with that expense when you get those bills a month or 2 later. Now let's talk benefit plan design real quick, and I'm going to do a live app demo here fast and just show you how to navigate that by syncing my smartphone here to the screen. But before that, I'm going to show you the impact on benefit plan design that Healthiest You has. So we took this data here from our top producing consultants across the country, and their feedback has been, you know, Healthiest You really changes the presentation. So when you meet with the group, especially here with this new technology, when you meet with a group, you say, you know what, the first thing we need to do is we need to provide this technology platform, okay? And we're going to put Healthiest You's telehealth component on that platform. Why? It's going to give your employees 24/7 access to their own concierge physician network over the phone in 48 states for free. So they can resolve over 70% of their needs there. So we're going to redirect them out of the costly health plan over to Healthiest You, because that's where they can go for 70% of your needs. Show them how to find the best prices on medication. We'll expose their deductible, help them find in-network providers. It's going to take some of the stress off of HR when an employee calls up and says, where's my deductible, or how do I find a doctor in my network? Now the HR director says, well, just go to your Healthiest You app. It's all there. So 70% of your needs can be resolved with Healthiest You. Next, this is the puzzle master here, right? What's your major medical piece that goes with that? And that's where your expertise, everybody on this line, you choose that best product that fits their needs. Maybe it's time for them to go self-insured. Maybe you want to go to an HMO, an HSA. You've got your options. Plug that in and wrap it around Healthiest You. And that's where they go for 30% of their needs. A lot of you on the phone here like those supplemental medical products. You know, you're doing high deductibles, so you want to put a gap plan in, or a hospital indemnity, or an accident plan. Plug those in and wrap those around the benefit offering. Then you're down to your dental and your vision, your ID theft, whether ancillary products, and then down to your financial. So when you follow this flow on benefit plan design, lead with Healthiest You. It's going to differentiate yourself from your clients. It's going to give you something new and fresh to talk about. You're going to look like you are the technology master. You've got the best of everything out there. Follow this program, and it really does work. Now, where does Healthiest You fit? So I think when you first present Healthiest You to a broker or consultant, they say, oh, self-insured, right? Self-insured is a no-brainer fit. But 60% of our book of business is fully insured business. So under 100 lives, fully insured, block rated, Healthiest You is an awesome fit for that because it gives you flexibility on which products you can put in there. So maybe you go with a little bit leaner medical product because when they can go to Healthiest You for 70% of their needs, they probably don't need a $10 copay. But we have groups that certainly have zero copays, and they got Healthiest You because they want the richest plan out there. Whatever your needs are, Healthiest You fits there perfect. The ACA plans, you've heard us talk, year and a half ago about how to turn bronze into gold, right? How to take a inexpensive ACA plan, plug a Healthiest You in with it. You got a bronze plan that feels more like a gold for the price of a bronze. Great fit for ACA plans. We're doing a lot of MEC and limited med opportunities right now where Healthiest You becomes the front of that MEC plan or that limited med plan, engages a consumer, gives them the telehealth piece, all the components of that. It's a perfect fit. We're partnering with payers. As you notice, we're built into the United Healthcare All Savers program, which is a product designed for self-funded groups under 100 lives. Been a wildly successful product across the country, growing like crazy. And Healthiest You's had a big impact on the front sales and utilization and engagement of the consumer with that All Savers program. So other programs in the works here with payers as well. TPAs, again, tremendous success. The TPA can take the product, put the puzzle together, put Healthiest You in there. Great fit. Associations, individuals. We do have an individual product. Online administrators. There's a perfect match for Healthiest You regardless of that opportunity. There's always a great fit for that. All right, so let's talk pricing real quick. So we've got tiered pricing based on the employer group size. So we start at the $2 to $99 space. We're at $9 per employee per month, 15% commission built in there, and they get unlimited access. So there's never any extra fees. There's no consultation fees. There's no bump in price on utilization. It's like a gym membership. You got full access. You can use that gym as much as you want. No extra fees. 100 to $249 goes to $8. Then it goes down to $6 here to $500 to $999. If you have an opportunity over 1,000 employees, we found the best process to be if you can sell it at $6, or you can call us for a quote. Let us know about this opportunity. Let's take a closer look, and we can see if we can sharpen that pencil a little bit and give you a better deal on that. So don't be afraid to reach out to us and discuss any opportunities you might have. On the individual and family side, so this is voluntary. This is outside of a group plan. $11 for the individual, $15 for the family. Same rules apply, 15% commission, unlimited access, no consultation fee. I can tell you on the individual side, you use it one time, a doctor visit, find the best price on medication. It offsets the cost of Healthiest You for the entire year. So it's definitely a no-brainer on the individual side when you're selling those individual products. All right, now let's jump back here, and I want to encourage everybody to use that chat box or the questions box here on your GoToWebinar control panel. I'll kind of jump to some of these here real quick. See if we can answer these as I'm transition here to the app demo. Okay, maybe we get, let's see, maybe we get a copy of this PowerPoint. I'm going to show you where to get a copy of this PowerPoint and all of our great materials on our partner portal, which is our online access for our distribution partners to get everything that you need here for the marketing side of Healthiest You. Is the app available in Spanish? Yes, it is. I'm going to show you a really cool button that you can put right on the app that converts the entire app to Spanish. Is this permanent pricing? Good question. It is permanent for now, right? But we are in healthcare, and we feel potentially that if utilization goes through the roof with the app, which is possible, we may have to come back and revisit pricing down the road, but that is certainly yet to be determined. But if you think about it, everyone on this line's goal should be to drive up the cost of Healthiest You. Because if Healthiest You raises their prices, there's millions of dollars being saved on the back end at that employer group because they're calling Healthiest You instead of going to the emergency room, urgent care, and primary care office. So every time you use Healthiest You, there's tremendous savings for the group, and I'm going to demonstrate that here with one of our tools. So everyone's goal on this line should be Healthiest You has to raise their prices because utilization is so high. That means we are having a huge impact on the healthcare costs in this country. Okay, I assume that Android users need to be enrolled before they can access or download the app. You can download the app prior. You just won't be able to log into it until you have a membership. So you can buy your individual membership, or if you have it through a group, you will be able to log in at that point, create your login credentials and whatnot. Okay, here's a question on reporting here, and I'll kind of jump to that and kind of dig into that a little deeper here when we get into our ROI analysis. Okay, if a group wants this, can they offer to employees that are not on the plan, such as those that are part-time or covered by another plan? Yeah, that's a great question, and thank you for the reminder on that. We have lots of groups doing this right now where they want to pay for Healthiest You as part of the benefit plan, but they're going to buy it for everybody. All the employees are part-time. Whether you choose the health insurance plan or not, if you opt out of health insurance, you still get Healthiest You. So you bet you can offer that to everybody. There's a big movement right now for groups doing that because they want to provide something nice. They want to reduce absenteeism, increase productivity. It's such a low cost but high value benefit. We have a lot of groups that are offering it to it. So we're going to activate whatever census you send over. So if they've got health insurance coverage with the group, great. If they don't, that's fine. We don't care here at Healthiest You. We're going to activate whatever that census is. Okay. Can this be sold to individuals? Yes, it can be sold to individuals. Pricing is $11 for the individual, $15 for the family. Gives them full access. Okay. Will HY have online group enrollment in the future? And we have some functionality right now to upload a group in a sense that you can do that. I'll show you here in our member portal in a moment. Okay, good questions. Have any more questions? Keep them coming. Please use your questions box there on your GoToMeeting control panel. Real quick, I'm going to give you a fast demo of our new app. I'm going to sync my phone here, assuming everything works okay, to the screen. Then I'll show you our partner portal, where to get all of our tools. Okay. Give me just a moment. Okay, we've got that activated now. Let's bring this up. Give it just a second. I hope the GoToMeeting's not going to interfere with this. Yeah, it seems to be struggling a little bit here. Let's try it one more time. If I can't get it synced, we may have to keep moving. So I seem to be having some issues. I'm going to try to shut down my phone here and reboot it. And we'll give it a shot here in just a minute. So while my phone is rebooting, let's jump to the partner portal. We'll come back to the app demo here hopefully in just a moment. Okay, the partner portal. So to access that, you just go to HealthiestYou.com. You see these tabs here on the top. Partners, the green box in the top right-hand corner. Click this, and you can create your own account if it's your first time. Log back in if you're already registered. That's going to give you full access to all of our tools. When you log in, it's going to look like this. You're going to have your dashboard. So you'll have an opportunity here to get contracted with us. If you're working through a general agency, you can get contracted direct through them. They're all set up to take in your information. If you want to buy this service for yourself, that's the first thing our partners do is they end up, of course, buying the membership. It's a lot easier to sell it. They see the great value in having it for themselves or their family. Just click enroll now. We're going to give you a 30% discount. So for an individual, it's a whopping $7.70 per month. For your family, we're going to take you down to $10.50 per month. So it really is such a value at that price especially. So we encourage you to enroll yourself, get access to the membership so you can download the app, demo it, and of course share it with everybody. It shows your deals that you have on the pipeline. So these are proposals that you have sent out. We've got a proposal generating system, an ROI analysis, email marketing, the monthly volume of those proposals, current weather where you're located, your activity feed based on the interactive proposals you sent out. All the health insurance news aggregated here from across the web. You can Facebook this, Twitter, LinkedIn, email it, go right to the article. So good content always coming in there. If you want to send an email to somebody, just give them an introduction to Healthiest You. It's real simple. Just put in an email address, click a template. It'll give them a nice overview of Healthiest You and what we offer. We do have an automated webinar system right now, which is actually being updated as we speak with the new messaging. So the webinar system will be down for a few days as we're adding the new messaging with the app demo and all the cool stuff coming out there. So stay tuned on the webinar system. The calculator, this is a great exercise to run through with those self-funded groups. Makes it very easy to show them the tremendous value that Healthiest You can provide using our average utilization rates. So let's say you've got a 1,000-life group as an example, and we'll put them at $6 just for demo purposes here. The family is included, so we're going to put them at 0. We're not going to charge any extra for the family members. So let's say you're doing 2,500 primary care visits per year. We're doing 950 urgent care visits and 400 emergency room visits. So, of course, you'll have that data there from the payer and can punch in the real numbers. I'll use some industry average figures here. Let's say the average cost for a doctor visit is $125, urgent care $175, and ER we'll put it at $1,000, even though it's usually about $1,300 across the country. Now let's say we can just redirect 10% of those claims. So instead of going into that urgent care center or emergency room, they're going to call up Healthiest You. They're going to get their issues resolved. Just 10% of those visits is all we're going to carve out. That would put us about a 38% utilization rate. So we're going to take 3,850 total doctor visits. We're going to redirect 385 of them to Healthiest You. This is very easily done with most groups on the books in this example. The average cost per visit. So you're spending $72,000 for Healthiest You for the year, but you're saving $87,875. So if they say, well, I don't know if I want to do that. You kind of got to check their pulse. This is the first benefit they can provide where they're actually spending money to save money. So it really becomes no cost to that group, and you can demonstrate that easily here. Not only is it no cost, they're actually getting, in this example, a 22% return on their investment, which is lower than our average utilization rate. So if they can hit our average numbers, their return's even going to be higher. So we'll show the savings by year. We'll show just an increase in utilization each year. Because what we see is with the Healthiest You gets in with the group, utilization goes up each year because people talk about it more, they use it more. It just kind of marinades within the company, and everyone is aware of it. Show the 3-year savings by location, the reduced absenteeism figures. This comes from EPA, U.S. Bureau of Labor, and the AMA. Environmental impacts, you're not driving to the doctor anymore. Huge savings in the CO2 footprint, fuel, mileage, and so on. So you can come back and you can say, look, I think this group can do more than 10% redirection. I think they can do 15% redirection, right? That's going to spend $72,000 to save $131,000. So now it just really becomes obnoxious to say, what, you guys got to have this benefit. And that's just looking at simply doctor redirection rates. It's not factoring at absenteeism and productivity. It's not factoring the fewer HR calls you're going to get because everything's so easy to navigate on this Healthiest You app. Okay, now let me show you one more thing here, a couple more things real quick on the partner portal. And then I'm going to test my app one more time. So proposals, let's say you've got a group that loves Healthiest You. You want to send out a proposal. We've got a proposal system here that's very easy to use. You can simply put in the number of employees, the cost breakdown there. They can watch the video. They can learn more about Healthiest You. They can accept the proposal, request changes, download it. They can click on the links here to learn more about Healthiest You. It's interactive. So when they open it, you email it to them, or you can print it off in PDF. But if you email it, it does notify you when they open that. Time to follow up. They opened up the mailer, or the email, excuse me, and time to close that group. So right here, we had a question on the question box here. Where do I get this PowerPoint presentation from today? Right here under the employer flyers, you see the broker presentation. We have an overview flyer here, enrollment forms. You can upload the group. Right here, somebody asked, can you upload a group online? Sure. You can just submit it right through here. Our enrollment forms are very simple. We have a group application, and then we just need the census. And then, of course, we'll call you, follow up, make sure everything's good and active and ready to go. So very simple to use. We have an enrollment site here. You've got your own landing page. You can market this, link it to your website, send it to folks, have them look at Healthiest You. They can request a quote right from your individual site. You've also got an enrollment site. So if you are selling individual plans, send them right to the website here. They click Enroll Now. They choose their plan. We collect the payment on that and pay the commissions back for every order tracked through your website here on your turnkey websites on the partner portal. Now I'm going to open up for questions one more time here before we jump to hopefully the app demo here. So we've got some more questions that have come in. Let's see here. Can the member get a Spanish-speaking doctor? Yes, we have Spanish-speaking doctors, care line representatives, and the app that will convert entirely to Spanish. Who constitutes a family? So same rules apply that apply for your kind of family health insurance coverage, right? So dependents under the age of 26, or up to the age of 26, I should say, living in that household. Now, if you've got a college student away at college, that's fine, right? They're under that 26 years of age there. Question around the iPhone. Yeah, iPhone app is in the approval process right now. Should get word here any day from Apple that it's approved, or if there's any changes they suggest, they will provide those to us. But it is submitted to the App Store in the approval process. Droid is live on Google Play. Okay. Here's a question on the app. You can enter the insurance information for the primary member. If you want to enter insurance, if there's insurance information for another member, you can download another app for like a spouse. They can download that and they can put their insurance information in that app. So they'll have the primary member and spouse will have two different apps if two different health insurance plans exist there. Okay, here's a question around overprescribing of antibiotics. Is telehealth positioned to really overprescribe? And this has come up, over the years. And if you look at telehealth antibiotic prescriptions, it's actually let me step back. If you look at our complaints, which we rarely get, but many times the complaints are, look, I called in and I wanted an antibiotic and the doctor didn't give it to me. Well, the doctor didn't give it to you because based on that diagnosis, you had a virus, and an antibiotic's not going to help a virus, right? So we're not in a position to quickly prescribe medication by any means. In fact, we hear frequently that an in-person, face-to-face doctor visit there's much more pressure on that doctor to prescribe a medication when it may not be necessary. Where over the phone, they're not as quick to prescribe that. It's up to the doctor's prescription, the doctor's discretion on if that medication is appropriate and if it should be sent over. So, today there are no issues that have been brought up or exposed at all on the telehealth side that there is over-prescribing of medication. Okay, do we offer exclusive contracts for territories? We do not, but we do, we're not out to contract every single agency across the country. We are very specific about who we partner with. Let's see here. Our commissions paid each year. So yeah, the commissions are level. They're paid each month, every month for as long as they're a member. They don't go down year 2 and year 3. It's a level commission. Okay, how long has Healthiest You been around? So myself and my partner that founded the company, we've been in telehealth for 7 years. Healthiest You's been around for about 3.5 of those 7 years. Okay, so good questions coming in here. I want to jump back here. I'm going to give it one more shot to sync my phone to the screen here. I rebooted it. Hopefully it's ready to go here. So let me shut this down here. And reminder, if you have any questions, feel free to use that chat box there. Okay, let's give this one more shot. Let's see here. So far, no luck, which is very strange. I demo this just about, well, at least once or twice a day, and it is not working on my screen right now, so I apologize for that. Might have something to do with the GoToWebinar presentation. So what we are going to do is I'm going to record a short screen presentation here of the app, and we will email that out to everybody on this line. So you'll be able to watch the video on that. I apologize, but my phone is not syncing with the computer today. So with that, let's go ahead and wrap up here, and hopefully we'll be able to get that app demo to you. I think we covered it pretty well in the PowerPoint presentation there. But let's go back and see if there are any more questions here before we wrap up. Okay, if we quote a big group, will you support that first in agent? Yeah, we really don't have many issues with that at all with agents, quoting the same company. It's very, very rare, but we do certainly do our best to support that one broker in that opportunity. Okay, broker's website connection for prospects to get their own quotes, enrollments, etc. So to access your partner portal, it has all the tools. Again, partners here, partners tab at HealthiestYou.com. Create your login, and they can go to your website to request a quote from you, and then you can provide a quote. Now, we have a team here at Healthiest You that all we do is support you all. So you've got your own assigned account executive here that can help you do demos for groups. Typically, we do these all day long in the webinar system. If you got a group that you want to demo Healthiest You to, let us do it for you. Just plug us in on a webinar. We'll answer all the questions, give them the demo, usually about 20 minutes long. They love it. I tell you, if you let us demo that to them, the close rate is over 90% on those groups. When they see this demo, the app, the technology, everybody wants it. I mean, it makes so much sense. So just, yeah, feel free to use us here at Healthiest You to contact us. Go to HealthiestYou.com, click contact. Here's our phone number, support line, email support@HealthiestYou.com. Let us know what we can do. Do you find any correlation between group size and utilization and savings? Group size, boy, utilization is the average for our entire book of business of over 3,000 groups is 42% right now. And we have groups ranging from 10 employees to thousands of employees all across the board. And I will say, doesn't matter the size of your company, there is high motivation for utilization with Healthiest You. So I wouldn't say there's one particular industry or group size that has the best utilization. It's all over the board. Okay, we have, this is a good question here. For currently enrolled All Savers groups, can employees that waived the All Savers coverage still have access to this through the group? Yes, so what that would be, so folks that didn't choose the plan in this particular group, they can buy Healthiest You or payroll deduct it at those voluntary rates that we discussed. So if you come back here to the PowerPoint slide, we'll bring this up. You've got individual at 11, family at 15. So anybody outside the plan, they can buy that on a voluntary basis, payroll deducted, or just pay with a credit card, and they can purchase that individually. So just a refresher on All Savers, that Healthiest You is included in the All Savers program. So United Healthcare's picked up the tab on that. There's no commissions paid out. It's just part of the offering, but you certainly can take Healthiest You and sell it outside of All Savers with our program here with your other groups that may not have it. any of their other employees at that company that may not have chosen the All Savers Health Insurance coverage. Okay, have you had any issues with sending scripts to Target? I heard feedback they will not accept the scripts from telemedicine. No, we've had very, very minimal issues with prescriptions being sent to Target. We fulfill prescriptions at Target every single day. Okay, can we get the PDF of the webinar? Absolutely, that's in the partner portal. You'll have this entire PowerPoint presentation here that you can access at HealthiestYou.com under the Partners tab. Okay, is the notice you are in an urgent care location or pharmacy new? Yes, the technology, the geofencing technology is new, and that is specific to the smartphone app. So the Droid app just rolled out, went live just this week. Apple should be approved any moment. So you've got that app on your phone. You walk into an urgent care center. We've got most of them fenced and more coming on. That'll remind you that you have Healthiest You, and that is new. Okay, is geofencing exclusive to you at this time? Yes, there is no other healthcare provider, period, telehealth or not, that has any geofencing technology in their app. Nothing that I've seen, and we've looked at all types of healthcare solutions and never seen anything like that anywhere out there. So that is exclusive to Healthiest You right now. All right, to get started, reminder, use the service. Registered brokers receive a 30% discount. So create your partner portal account. Once you do that, you're going to get signed an account executive. So if you're working with the GA, they're going to support the heck out of you like they always do. We've also got an internal team here that will support you. Buy that membership for yourself. It's 30% off. It's a great deal. So you can download the app, you can demo it, you can show people how it works. Awesome. Then use our broker support team to help you close your first deal. Let us do that presentation for you. Don't be shy. We love to do that. We want to make it easy on you, and don't be afraid to bother us at Healthiest You, right? So let us help you. Okay, I just want to check, see if there's any more questions that have come through here on the question box. Okay. I think we there's one question around the Windows-based phone. There's no Windows-based app yet. That one's still in development. So we've got Droid and Apple soon to be approved, but Droid is active, so no Windows-based phone today. Okay, well, I want to thank everybody for joining our national webinar today here on April 2nd. We know y'all are very busy, and we respect your time, so we appreciate the fact that you chose to spend that last 40 minutes with us here today. So thank you so much, and let us know how we can help here at support@HealthiestYou.com, and we look forward to working with each and every one of you. So thank you so much, and have a great day.